Hello, I'm going to be talking about health and social justice. What does it all mean? The abstract concepts into the practical applications. That's what we're going to be talking about in this class. So before we jump into what that means as far as health, when we look at social justice, it's really looking at the terms of distribution of wealth, opportunities, and privileges within a society. It's the idea that individuals may not have equal access to wealth, opportunities, and privileges. And when it comes to health and social justice, we're really looking at health resources, health access, the ability for people to obtain things that they need to have the basic needs to be healthy. So one of the big things that we first look at are health differences. Health disparities, this word right here, disparities, also means differences. So it's the idea that groups of people can have different incidence and prevalence rates. And incidence means new and prevalence means ongoing. So they could have diseases and injuries that are higher for some groups than other groups. And this is really looking at data. We look at everything from race, ethnicities, between different groups, how someone's socioeconomic status is, sexual orientation, gender, disability status, geographic location, and a combination of these. What that looks like is, for example, life expectancy. This is a health outcome. Your ability to live longer is definitely related to your health and well-being. And we'll see that we have health disparities, health differences across the United States. From some people living up to 81 years, to some people living to 73 years, to 72 to 69. And let me tell you, a difference between 81 to 69, those are many, many years of difference. Look at this, 66 in some areas. So this is a health outcome. This is a health disparity based on a geographic location. Here's another example. You can even drill down to zip codes and see that even within one region, you can have some people living so much longer, 84 years, compared to 68 years. And these are different life expectancies within a geographic area. And this is drilling down to zip codes. This is Kern County in Bakersfield. And you will see that if you Google out and you look at life expectancies, health disparities, you'll see maps like this for Chicago, New York, and you'll see that people could just live a few blocks away from each other and have really big differences in health outcomes. And so the driller behind this is we really drill down and we start to say, and what I mean by drilling down is start looking at health equity. Do people have equal opportunity to attain his or their full health potential? No one is disadvantaged from achieving this potential because of his or her social position. And it's definitely different from health equality. It's health equity, in other words, saying that do you have or does someone have equal access to services? And so it's really looking at how things may be not equal. And it could be systematic, it could be unjust, it could be looking at distribution of social and economic and environmental conditions. It could be unequal access to health care. Do we all have access to health care in the United States? No. Do other countries have equal access to health care? Yes. Are there safety nets for someone? Do we have equal resources like grocery stores? Do we have grocery stores in equal access? Do we have equal access to unemployment opportunities and pay and income? So even getting access to unemployment resources, or even just getting access to employment opportunities can vary. And so this starts to look at something called the social determinants of health. And we will be hearing this term many, many times throughout this class. It's really looking at life-enhancing resources such as food, housing, income, social relationships, transportation. It's really looking at that to make sure that we have equal access. So why this can become a problem is that we can find that education is not always equal. Infants born to African American mothers with only a high school education were 2 times more likely to die in the first year of life compared to white counterparts. So we're finding that people do not have access to the social determinants of health. Their health outcomes are definitely different, and they're lower. And so we'll see this with low income, and we'll see this with ethnic and racial minority communities also are less likely to have access to grocery stores. So you'll see that this idea, this concept of looking at how things are distributed throughout an area is called an health equity. And we're addressing health inequities when we start to look at how these resources are distributed. And so one of the things that we're going to be talking about a lot in this class is going downstream. Typically, we've been looking at health problems when they hit, like infant mortality, life expectancy, what their rates are, their behaviors. What we're going to be doing in this class is looking upstream. We're going to be looking at social inequities and looking at how things may not be set up. There might be structural biases. Institutional inequities. Are there ways that we can create policies that create more equity within an institution? And living conditions. Are things equal with living conditions? Are grocery stores put, for example, throughout a community? Do people have equal access to walkable communities? I mean, even think about it in your life. Think about in your community. Are you able to walk to your grocery store? Do you feel safe in your neighborhood? Do you feel that your schools are strong? This is institutional inequities. All these things support health. And when I talk about this circle here, this is social justice and health. This is the health part on this side, and this is the social justice side in this circle. So in this class, we're going to really look at real life. I'm going to have you investigate local health challenges, services, and begin to really map out what are your challenges and assets for your community. And by the end of the class, you'll have a project. You'll explore a local health challenge. You'll use data sets to really lift up a health disparity. We're going to be focusing in on solutions. So when I talk about health and social justice, I'm talking about public health. And public health is what we as a society do collectively to assure that the conditions in which all people can be healthy. And this is why public health is so focused in on health disparities and health inequities. In this class, we'll be looking at these very closely. I have to tell you that this is one of my favorite classes to teach. It is empowering and it's engaging, and I look forward to seeing what your projects are at the end of the term and semester, but I also look forward to the discussions and your lived experience that you will be bringing to this class and the research that you will be bringing to this class. So with that, that's a short little video. And if you have any questions, if you're watching this video and you're not in the social justice and health class, this is something that you can definitely look at more, and you'll see that these classes are throughout community colleges and colleges in public health across the United States. And this is the essence and the foundation of what it means to be in public health. All right, have a great day, and thank you for watching this video.